Just this week, a GP trainee told me, I'm not sure what I'm going to do after I qualify. There's not a lot of job. Are you interested in a portfolio career? Maybe you're thinking you'd like to have more flexibility, you want to do more meaningful work where you feel inspired. Imagine you could reshape your career, do the things that you enjoy doing. In this video, I'm going to show you a glimpse of what I do as a portfolio GP. If you're new here, my name is Dr. Erwin Kwun. I'm on a mission to have doctors lead a fulfilling life. Let's get right into the video. Traditionally, people have joined a salaried post or going to partnership. Now, locoming is not really great because the market has dried up. So thinking about how you can reshape your career and diversify your skills so that you can become more of a portfolio doctor is where you can take control. Think about what are the things that you enjoy doing.
The intersection of what you love doing and what you're good at is your passion. What are you passionate about? What you see yourself doing 2 years, 3 years, 5 years? Think long term.
I enjoy teaching, and this is what I've developed my career into. So medical education. Now I'm going to show you a conversation I had with a newly qualified GP who's preparing for an interview. So you'll be able to see the insights and what you can do to prepare for a job interview. Show me the job advert, then we can go over it. So you see, they're looking for somebody who's forward thinking, somebody who's innovative. So these are keywords that in your answer, you have to be thinking as in, how do I demonstrate that? Maybe you've run a project in your previous practice and you've demonstrated that. Or it could be in a hospital job where you've done something that was innovative. The CQC report, they look at practices and see what are the problems and make recommendation. So when you read through the report, you'll be able to see what are the challenges that the practice encounter. And in the interview, there will be a time when they ask you like, have you got any questions for us? If I want to show that I'm curious and interested in a practice, I'll ask them like, as you're probably all aware that a lot of practices are facing different challenges. And I'm just curious, what are the challenges that the practices face recently? Usually the practices face challenges with regards to difficulty with access, or there might be problems with turnover of staff. They employed a salary GP, but then the salary GP went on sick, or it could be various things. So then if you understand the reason they are hiring somebody and what the challenges that they're facing, what you can do is like you can almost like walk them through what would be your suggestions. So as in, you've already thought through what are the solutions that you could implement when you start your job as a salaried. And that way, you're going to start from a different position compared to a candidate who has not thought through this. Next, I'm going to show you behind the scene of a coaching where I'm helping a GP trainee pass the SC exam. Unfortunately, this GP trainee failed multiple times and he's developed some bad habits that we're having to change now. The explanation is good what you're saying with the side effects. How you can get it to a clear path here is explaining that would be for long-acting pain relief. But then if David has got breakthrough pain, I'd also like to prescribe Oromorph to top up. For a palliative case, if you think about it from an examiner's perspective, they would be concerned whether a GP will be prescribing the PRN as well. Otherwise, in the middle of the night, the patient is in a lot of pain, they don't know what to do. It's quite bad experience with a patient then, okay?
Yes.
So if you are thinking about it, you definitely need to mention it, because what good is it to think about it but then verbalize it and then not getting the mark you deserve? So let's say this patient had agitation or couldn't sleep, then I would make sure I mention I'd also like to prescribe midazolam for agitation. That might help him. Or if he's having a lot of secretion, then I'd like to prescribe him Harisi.
When I watch myself, it's like with something like a GP.
Yes, yeah.
It's not me.
You're not like a hospital doctor anymore. You're more like a GP.
My marks shifted hugely in the management section from the first two attempts into the attempt in September that I passed.
In the clinical management, from a hospital background, I could see that there was that the doctor knows best, and the way that you had changed it was quite challenging, but then you understood the importance of giving option. But what's more important is giving the right option to the patient, because sometimes people just give options, but then some options are not that good. So when you give option, you're also discussing the pros and cons of the options. One of the things I've prioritized is health. So it's very important for me to make sure that I get at least 3 workouts a week. So I hit the gym and do some workout. I've been training on various exercise, cardio, and strength training as well. Now you're going to see a meeting between me and another portfolio GP. Hi, I'm here with Dr. Mahiba Rahman, Director of eMedica. Dr. Rahman launched his new book.
We had lots of doctors contribute by writing different cases many years ago, some more recently. We then commissioned more cases, we wrote some in-house, and then we added a section that explains the exam, the differences in the mark scheme, tips on how to prepare. Then there's a process of getting it proofread, laid out, then cover design, then getting an ISBN number, then you actually submit the data to, so that it can be distributed to book distributors and booksellers. And then we've published it in-house, but you could also, for example, publish via things like Amazon. So there's a lot of steps from having the idea to actually getting the content written, then proofread, edited, then the final steps of assembling it into an actual book, and actually getting physically printed.
Okay, right. So sounds like there's quite a lot of work into organizing, writing, editing, and then when it's all finally done, then tell us a little bit about the content of it for somebody who might be thinking, what cases should I prepare for the exam?
That's a great question. So what we did was the MRCGP SCA, the RCGP has 12 blueprint areas. So on any given day of the SCA, everyone will have at least one case that will touch on each of those 12 areas. And they're often a case that will go across different domains. So for example, one of the domains is, child health, i.e. someone who's maybe a teenager or a young child. One of them is, for example, chronic disease, and that could include someone with something like rheumatoid. It could include someone with cancer. One of them is frailty and end of life, like terminal illness. So you could have a young child that has cancer. You can see how that could span across multiple domains. But on any given day, they will make sure that all 12 blueprint areas are in every exam. So what we've done is we've made sure our cases cover all 12 areas, and there's a mock exam designed that there are 12 cases there covering all 12 areas within that mock exam.
After a busy week, I like to go for a walk to relax, clear my mind, and I'm going to take you with me on this walk.
Thank you for watching this vlog until the end. If you enjoyed this vlog, you might want to watch the next vlog here. Click here to watch it. I'll see you on the other side.